This video I'm going to talk about the cutaneous innervation of the lower limb. Uh, Here you can see in this diagram we have got cutaneous nerves which are just beneath the skin in and between the deep fascia. So here you can see different nerves can be seen. This is lateral cutaneous branch of the subcostal nerve in uppermost and lateral part of the thigh. Then in the lateral part of the thigh, here we have got lateral femoral cutaneous nerve. Then just below the inguinal ligament, here we have got femoral branches of the genitofemoral nerve. Then in the anterior part of the thigh, here we can see these are the cutaneous branches from the femoral nerve. Whereas in the medial part of the thigh, an oval area is being supplied by the cutaneous branches of the obturator nerve. And beside that, here we have got saphenous nerve all around. Then on the posterior aspect, here we have got on the buttock region superior cluneal nerves, medial cluneal nerves, and inferior cluneal nerves. Inferior cluneal nerves, because buttock is being supplied from three sides up, from superior aspect, from medial aspect, and from inferior. So superior cluneal nerve, medial cluneal nerves, and inferior cluneal nerves. And then we have got, this is the posterior aspect of the thigh. Here you can see perforating branches, which are, these branches are called posterior femoral cutaneous nerve. Okay, then here we have got sural nerve. So we are going to discuss each of these cutaneous nerve one by one. This is again this diagram, you can learn this diagram by heart, so when if there is a question of drawn label, you will be easily able to draw label. So now look at this is the anterior aspect, this is the anterior view, and here we have got lumbar plexus. This is all lumbar plexus, and lumbar plexus is formed by contribution of the T12 spinal nerve, which is subcostal nerve, T12, then L1 spinal nerve, L2 spinal nerve, L3 and L4. This network is called lumbar plexus. Lumbar plexus. Okay. So here we have got lateral cutaneous femoral nerve, which is formed by the contribution of L2 and L3 root here. L2, this contribution is from L2 root, and this contribution is from L3 root. They both unite to form a lateral cutaneous nerve of the thigh, and it passes between the psoas major muscle and iliacus, and then it from anterior superior iliac spine just medial to it, and behind the this ligament in inguinal ligament, and here this nerve is cutaneous, and it's this pink area hole. This nerve is supplying the and a bit of anterior and mostly lateral aspect of the thigh, upper aspect of the thigh, and this uppermost aspect of the thigh would be supplied by the lateral cutaneous nerve, branch of subcostal nerve, branch of subcostal nerve. Then here we have got femoral nerve. Femoral nerve is being formed by is arising from again arising from the lumbar plexus by the contribution of L2 here, L2 root, L3 root, L4 root. This branch is from L2, from L3, and from L4, and all of these roots they unite to form a femoral nerve. If you can see, this is femoral nerve, its root value within the bracket is L2, L3 and L4. L2, L3 and L4. L2, L3 and L4. And all of these roots, they unite to form a femoral nerve. Femoral nerve supplies muscles of the anterior compartment, iliacus, and but it has got two cutaneous branch which we are interested in, and these two cutaneous branches are, here you can see, anterior cutaneous branches of the femoral nerve. Here, anterior cutaneous, they supply the anterior and upper part, medial and anterior part of the thigh, living in oval area. Here it would be supplied by obturator nerve. Then it, this femoral nerve has got an interesting branch which is called saphenous nerve. Saphenous nerve here. Saphenous nerve is a branch of femoral nerve because, and these branches are being produced within the femoral triangle. Here, femoral nerve, it, it doesn't pass through the adductor hiatus, and then just beneath the tendon of the sartorius muscle, it moves further downward here, and its infrared patellar branch supplies the skin just under the patella bone. And then on the medial, anterior medial aspect of the leg, it moves downward, 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 and supply the medial margin of the foot and medial side of the foot, medial margin and anterior medial aspect of the leg. Here, this blue one, this is saphenous nerve. This is all saphenous nerve, and saphenous nerve is a branch of femoral nerve. Here you can see this is saphenous nerve, and it is branch of femoral nerve. Here, saphenous nerve. Okay. So next is, here you can see, as we can see, this is the medial side, medial aspect of the thigh. And an oval area shown in the blue here is supplied by the obturator nerve. And above this, it is being supplied by the femoral nerve. And anterior is being by femoral nerve, except for this oval area. This is supplied by obturator nerve. So what is obturator nerve? Obturator nerve is nerve of the medial compartment of the thigh. Likewise, femoral was main nerve supply of the anterior compartment of the thigh, and obturator is nerve supply of the medial compartment of the thigh. So how this obturator nerve is being formed? This is obturator nerve. So obturator nerve is also arising from the lumbar plexus. Here you can see lumbar plexus. And lumbar plexus is being formed by the contribution of the T12, L1, L2, L3, and L4 spinal lumbar nerves. So if you look here, obturator nerve, its root value is L2, L3, and L4. So it means that it is originating from the L2 here, L2 lumbar nerve. One contribution from L2, then L3, L3, likewise L4. So L2, L3, and L4, they contribute to form a obturator nerve. Obturator nerve descends, and behind the superior ramus of the pubis, just above the obturator externus muscle, is divided into two branches, anterior branch and posterior branch. And then these two branches pass between the adductor brevis and adductor longus. Adductor longus has been cut here. So here. So anterior division, it moves downward, downward, downward. After supplying the muscles of the medial compartment, it gives the cutaneous branch here. Cutaneous branch. And this cutaneous branch supplies the medial side of the thigh, oval area, obturator nerve. Okay. Now posterior aspect of the inferior part of the buttock, inferior cluneal nerves, and then posterior part of the aspect of the thigh downward till posterior surface of the popliteal fossa. This all blue. It is supplied by the posterior femoral cutaneous nerve. Posterior femoral cutaneous nerve. Posterior femoral cutaneous nerve. And here I want to show you how posterior cutaneous nerve is being formed. Now this is greater sciatic notch foramen, and these two nerves, sciatic nerve and posterior cutaneous femoral nerve. Its root value is S1, S2, and S3. It is being produced within the pelvis, then comes out of the pelvis through this greater sciatic foramen, and then moves downward parallel along with the sciatic nerve. And it is giving its inferior cluneal nerves here too, which are going to supply the inferior aspect of the buttock here, inferior cluneal nerve, inferior aspect of the buttock. And then this nerve moves downward and gives cutaneous branches here and supply the thigh posterior aspect of the skin here up till popliteal fossa. Okay, so what is happening next? Then we have got here a nerve called sciatic nerve. Within the popliteal fossa, it divides into two: tibial nerve and common peroneal nerve. Tibial nerve and common peroneal nerve. Okay, sciatic nerve divides into two: tibial nerve and common peroneal nerve. Tibial nerve gives another branch which is called medial sural cutaneous nerve here. This tibial nerve gives a branch medial cutaneous sural nerve. Likewise, this common peroneal branch is going to give another branch lateral cutaneous sural nerve. Lateral cutaneous sural nerve. So medial cutaneous sural nerve and lateral cutaneous sural nerve would be they would join each other by means of sural communicating branch. This sural communicating branch. So medial sural nerve or sural cutaneous nerve and or lateral cutaneous sural nerve. They are joined by communicating branch and result in a formation of a sural nerve. This is sural nerve. This is posterior aspect of the leg, and here you can see calf muscles. And sural nerve moves downward along with the tendocalcaneum, and it gives branches to the calcaneum and lateral border of the foot. This all pink area. It is being on the posterior and lateral aspect of the leg, posterior and lateral aspect of the leg, then lateral border of the foot, and then lateral aspect of the heel. This all area, pink area, is being supplied by the sural nerve in cutaneous innervation. Sural nerve. Sural nerve. Okay. And whereas this lateral cutaneous sural nerve, it supplies the here gray area, skin being supplied by the lateral sural nerve. So lateral sural nerve, common fibular nerve via lateral sural cutaneous nerve supply this gray area. Common peroneal nerve via lateral sural nerve supply this gray area. Okay. Okay. Now, if you look at this common peroneal nerve, it originates from the division of the sciatic nerve within the popliteal fossa. Then this common peroneal nerve winds itself around the fibula, neck of the fibula, and enters the anterior compartment of the leg. Here you can see in phantom view this common peroneal nerve. Then this is common peroneal nerve. It winds itself around this is head of the fibula, and here we have got neck of the fibula. So that's why it is most commonly damaged nerve, because neck of the fibula, whenever fractures, it also damages this common peroneal nerve. And common peroneal nerve, when enters the anterior compartment, it divides into two branches. Number one is superficial cutaneous nerve, superficial peroneal nerve, and deep peroneal nerve. Superficial peroneal nerve and deep peroneal nerve. Superficial peroneal nerve after supplying the muscles of the lateral compartment, and deep peroneal nerve after supplying the muscles of the anterior compartment. Okay, but we are concerned with their cutaneous innervation. So superficial cutaneous nerve divides into two branches. medial cutaneous and lateral cutaneous. And this nerve is going to supply the dorsum of the foot. Dorsum of the foot. Most of the dorsum of the foot. Okay, let me zoom it. Except for small cleft or small, triangular area between the first and second digit. Here we can see a small yellow area. This area would be supplied by the deep peroneal nerve, whereas the rest of the lateral side of the leg and dorsum of the foot, most of it, even medial side of the great toe, it would be supplied by this gray area would be supplied by the superficial peroneal nerve, whereas this small cleft between first two digits is supplied by the deep peroneal nerve. Here you can see superficial peroneal. This is deep peroneal nerve. Here just follow the deep peroneal nerve. Here, look at this thing. Deep peroneal nerve is supplying the small triangular area between first two digits, and rest of the foot is supplied by the superficial peroneal nerve. Look at this thing. Superficial peroneal nerve, after supplying the muscle, it comes onto dorsum of the foot, and it supplies the most of the dorsum of the skin of the dorsum of the foot, and this is deep peroneal nerve, and it supplies the small triangular area between the first and second. Here, this yellow area, it is supplied by the deep peroneal nerve. This, whereas the rest of the foot is supplied by the here superficial peroneal nerve, even on the medial side of the great toe. Okay, and this lateral side pink area, it is again sural nerve. This sural nerve, posterolateral aspect of the foot. Okay, so this here within the popliteal fossa, sciatic nerve was divided into two: tibial nerve and common peroneal nerve. Okay, now look at tibial nerve. Tibial nerve enters the leg and supplies the posterior compartment muscles of the leg. Then behind the medial malleolus, it enters the foot and divides into medial and lateral plantar nerves. Medial and lateral plantar nerves. Medial and lateral plantar nerves are actually branches, terminal branches of the tibial nerve. Tibial nerve is a division of the sciatic nerve. So in actual, sciatic nerve is the nerve which is solely responsible for the, because these all branches you looking at in the lower limb are branches of the sciatic nerve. Okay, medial and lateral plantar nerve. Okay, now look at this purple area. This is supplied by the medial plantar nerve, skin, cutaneous innervation. And look at it here, this yellow one, lateral plantar nerve. So medial plantar nerve, lateral plantar nerve, these are branches of the tibial nerve. Tibial nerve is a branch of sciatic nerve. And beside that, here you can see this small green area. This is supplied by branch from the tibial nerve as well as branch of the sural nerve. This green area. Okay. So cutaneous innervation, these all, for example, lateral cutaneous nerve, femoral branch of genitofemoral nerve, ilion guanal nerve, then obturator nerve cutaneous branches, anterior cutaneous branches of the femoral nerve. Here we have got lateral cutaneous nerve of the thigh. Then this is saphenous nerve, which is a branch of femoral nerve. We have already discussed. And here we have got superficial peroneal nerve, supplied dorsum of the foot. And small this area, it is supplied by the deep peroneal nerve branch between the first and second cleft. Then in the buttock region, cluneal nerves, superior cluneal nerve, middle cluneal nerve, inferior cluneal nerve, and their root value is also written with them. Then posterior cutaneous nerve of the thigh, which runs parallel along with the sciatic nerve. Then here we have got sural nerve, a branch from the tibial and common peroneal, and they unite and sural nerve, and medial and lateral plantar nerve. So I hope I tried my level best to make things easier. I hope it you will get benefited from my video. Thank you very much.